Okay, some other exciting things that are happening, again, for trying to treat that off time because the levodopa doesn't last long enough. So these are, again, still in clinical trials. There's a medication we're calling the accordion pill. So basically it's layers of carbidopa-levodopa that then gets folded up like an accordion. You can imagine it's like up and down like that, and put inside a capsule. And what happens is, because of the way it's made physically, it hangs out in the stomach and gets released slowly over time. So again, the idea is make the levodopa last longer, and this is one way that they're trying to do it. It looks like they think this will be a 3-time-a-day drug, which for people who are taking their levodopa 8 times a day, that could be pretty good. So that's one study that we're doing. Another one is the levodopa pump patch. So this one I'm actually really excited about because if you guys have ever seen, like, insulin pumps nowadays are pretty small. You guys have seen those? And basically they're pretty easy. You stick them on your arm, and then they have a little needle that goes underneath the skin to deliver insulin. So this is a similar idea, but it's a levodopa pump patch to be worn on the abdomen, and with a little needle deliver small amounts of levodopa all day long, which would really be ideal. And in a patient without Parkinson's, that's what the brain sees, is bits of some dopamine all day long, but at a pretty constant rate. So I'm pretty excited about this one, and I think it could help a lot of people if it ends up working out. And then also because there is a pump on the market that's approved right now called Duopa, and this is already FDA approved, the Duopa is, but it involves a tube through the stomach connected to a pump that goes down into the intestines to deliver small amounts of liquid levodopa all day long. But you can imagine that's somewhat invasive to have a tube in your stomach all the time, all day, and it's sort of in an inconvenient place. You know, if you're bending over, there's lots of friction there. But that is on the market, and this is a similar idea, but less invasive. So I think that could be pretty promising. And then we have another medication that is a partial dopamine agonist. So like we talked about, the sublingual apomorphine, that's a dopamine agonist. And then there's also Mirapex, Requip, and Nupropatch, if you guys have heard of those. Those are dopamine agonists. So they provide moderate benefit for slowness and stiffness, not quite as good as levodopa, but moderate benefit. However, they do come with more potential side effects that we don't like so much. Not everyone gets them, but there are definitely potential side effects, which include impulse control disorders. So those are things like hoarding, gambling, hypersexuality, spending too much money, etc. And sleepiness. So it can cause sudden onset sleepiness where people will be driving and then they fall asleep. Not good. So this new medication is a once-a-day drug that they think in animal models looks as effective as levodopa and doesn't have those same bad side effects as the normal dopamine agonists that are already on the market. So this could also be fantastic if it works out. Once a day, as good as levodopa, without the same side effects as the other dopamine agonists. Still can cause nausea though, which almost all of them can. Questions there? Who wants a levodopa pump patch?
You didn't mention Parcopa.
So Parcopa is just carbidopa levodopa, but it's an oral disintegrating tablet. And this is one that's already on the market. It's a little bit tricky because some patients swear to me that it works quicker than regular Cinemet because it dissolves in their mouth. But what actually happens is it just dissolves in the saliva and they still have to swallow it, and it gets absorbed in the intestines the same place as Cinemet. So according to Dr. Hauser, doesn't work faster. Some people think it does, and it can be potentially beneficial for people who are having trouble swallowing. If you can't swallow your pills, we can just put them in your mouth and it'll dissolve and then you'll be able to swallow it. Okay, and then there's Michael J. Fox. I put him up there because we know him for having dyskinesia, the twisty-turny movement. But another thing that's been in clinical trials that looks pretty promising and will likely come out on the market is extended-release amantadine. So like I mentioned before, that's the medication that's most helpful for treating the dyskinesia, but has these potential side effects of hallucinations. And it looks like this extended-release amantadine may be better tolerated than the one we have. Okay, so now on to what are we going to do to slow down the disease, which is the major question. because we're pretty good at replacing the dopamine right now. Although, as you can see, sometimes it doesn't last long enough, but we're pretty good at giving the dopamine back to patients to help with slowness and stiffness. But it's when the Parkinson's disease gets more advanced and causes problems with memory and thinking and balance difficulty that we have troubles, because levodopa doesn't help those things. We borrow medications from the Alzheimer's folks for memory and thinking, but levodopa has no effect on the memory and thinking, and the Alzheimer's medications are only mildly effective. So if we could stop the disease from progressing to the point where it causes these issues, that would be great. So what we think is at the heart of Parkinson's disease is this misfolding and aggregation of a protein called alpha-synuclein. It's kind of funny because we don't even really know what the function of alpha-synuclein, this protein, is in healthy brains. But we do know that clumped up alpha-synuclein is a big component of Lewy bodies, which are the hallmark of Parkinson's disease. So when they do an autopsy on a Parkinson's disease patient, they find Lewy bodies, which include clumps of alpha-synuclein. So we know that something's going awry there. So a lot of the, there's something like, I think Dr. Hauser said, even just a year ago, that there was something like 50 different compounds in the labs trying to attack the clumping of alpha-synuclein. So that's pretty exciting, because the more people working on it and the more potential compounds, sooner we will get there, hopefully. There actually is a vaccine in clinical trials right now looking to attack that clumping of alpha-synuclein, and also an antibody, same idea. So basically the vaccine they give you makes your body make antibodies to the alpha-synuclein. And then there's also a medication that's in trials right now that just gives you the antibody to fight that clumping of alpha-synuclein. So I think those two things are pretty promising. That's supposed to be a picture of alpha-synuclein, just so you know. And then some of the other trials that are going on right now to try and slow down the disease are studies of a medication called isradipine, which is a calcium channel blocker. So it's a medication that's actually already out on the market to treat hypertension. So we know that it works to lower blood pressure, but now we're looking to see if it can slow down Parkinson's disease. It looks positive in animal models, and right now it's in a phase 3 study in humans. The thought process behind the isradipine goes like this. So when neurons are young, they use sodium channels to conduct their potentials. So basically sodium comes into the cell, makes things happen to make that cell release what it releases. That's when nerve cells are young. As they get older, they use calcium channels instead of sodium to conduct their potentials. So the theory behind this isradipine medication, which is a calcium channel blocker, is we want to block the calcium channels and force them to use the sodium channels again to conduct their potential, because it looks like calcium is somewhat damaging to the cell and makes it less likely to withstand insult from Parkinson's disease. So basically it weakens the cell. So if we can block the calcium from coming in and make it use sodium instead, maybe we'll make the cells stronger and slow down the disease. So that's the thought process behind the isradipine. And then the other medication that we're looking at is called inosine, which is a medication that increases urate in the blood. So in previous clinical trials, we found that people who have low urate levels, Parkinson's patients that have low urate levels, it looks like it might slow down progression if we increase their urate levels. But that's only for patients that have low baseline levels to begin with. So, and actually urate, if it's too high, is the chemical that causes gout. So you have to be careful about where you keep those levels. But that's another study that we're doing that's in phase 3 right now. So very exciting, lots of potential, things are happening in Parkinson's disease. So we can be glad about that.
Are those also things that will affect Alzheimer's type problems? Does it work the same way or totally different?
Yeah, so it's a good question. So as far as the alpha-synuclein, that's pretty specific to Parkinson's disease. There are some therapies out there, not necessarily these ones up here, but I think there are things being studied that could potentially help both, because Alzheimer's too is a problem with proteins going wrong in the brain, basically. So if we can intervene in one, we may be able to intervene in another. Yeah. Any other questions there? And then just since we're on the topic of research, and it's so important, that actually in the last, let's see, I've been here 4 years, and there have been 4 drugs approved in the last 4 years for either Parkinson's or a complication of Parkinson's disease. So the one I don't have up here is the one we already talked about, which is the Duopa pump, liquid levodopa pump, to help people who have the ups and downs and dyskinesia, smooths them out. And then we have Rytari, which is the newest carbidopa levodopa formulation. It's an extended release, and this is a little picture right here. So in the capsule, it contains both immediate release beads, like regular Cinemet, and extended release beads, and I think there's even one in between. So there's like some that release now, some a little later, and some a little later, so that the levodopa lasts longer. So this has been on the market maybe now for, I want to say something like 1.5 years. We've had some mixed results. Some people do really well with it, and some people don't. I would say I'm more positive than negative, but it's not the ultimate solution for everyone. But for some people, it does really last longer. And it's kind of nice because it comes in lower dosages than Cinemet. So sometimes we use it for patients that can't tolerate regular Cinemet because of nausea or other various reasons, but we can get them at least some dopamine by giving them some Rytari at a lower dose. Then there's a medication called Northera, which is used to treat what's called orthostatic hypotension, and specifically neurogenic orthostatic hypotension. So basically what that means is that the blood pressure is dropping when people change positions from sitting or lying to standing, and their blood pressure drops, and they get lightheaded and dizzy, and sometimes pass out. And this is because of the disease. Parkinson's disease can cause this complication. Not in everyone, but it can. And that's because the autonomic nervous system is also affected in Parkinson's disease, to the point where those blood vessels that should constrict when you stand up to maintain blood flow to the brain don't do that. They don't do what they're supposed to, and so the blood pressure drops. So this medication, Northera, helps to raise the blood pressure. And it's the first medication, it's the first medication in its class specifically for neurogenic orthostatic hypotension. So that's actually been pretty exciting, and it has been beneficial for some patients. I think there's more to see on what that can do, but I've definitely had some patients get benefit from it who didn't respond to other medications that raise the blood pressure or couldn't tolerate the other medications. And then we have Nuplazid, which is the newest medication that's been approved, and this is approved for Parkinson's disease hallucinations and delusions. So this can be a complication later in the disease where people experience psychosis, basically. And this was a really important drug to come on the market because up until this drug, there was nothing specifically for Parkinson's disease. So we would borrow from the other antipsychotics, and that gets tricky because a lot of the antipsychotics block dopamine, which is the last thing a Parkinson's patient needs because they need all dopamine they can get. So prior to this drug, there were really only 2 drugs that were safe to use in Parkinson's disease psychosis, Seroquel and Clozaril. And Clozaril has some safety issues with it to the point where people have to get their blood tested every week or every couple weeks. So we didn't use Clozaril very much, and we were basically limited to Seroquel, which sometimes worked and sometimes didn't work. So this new drug, Nuplazid, is specifically for Parkinson's, and that's pretty new, so we don't have a whole lot of information on how effective it is yet, but I think it can definitely help some patients. So that's exciting. Any questions on those?
Do people who haven't been diagnosed with Parkinson's oftentimes end up with pacemakers because of this low blood pressure situation?
No, so I don't see that very often. And because usually heart rate is okay. The heart rate and the pumping part is okay. It's really that the nervous system that should be controlling how the blood vessels constrict and relax, that's the part that's goofed up, which a pacemaker wouldn't necessarily help. So I would say no. Other questions here? Okay, I think that's it as far as recently approved. So, I'm happy to answer any questions about research, any questions about Parkinson's disease. Anybody? Yeah.
You mentioned proteins. Have there been other, any research on the effects of diet with Parkinson's or trying to?
So generally what we tell patients is healthy diet. so normal healthy diet, multivitamin, but I don't know of any trials that have shown benefit to any supplements or anything like that. In fact, we did do studies in creatine. They did a long study of creatine to see if that might slow down the progression, and it was negative. I think that was 7 years long. And they also did a study of CoQ10 for Parkinson's, and that came back as negative. There have also been studies, probably some of you have heard of glutathione for Parkinson's, and that's, I would say, somewhat controversial. So there's a doctor that likes to do glutathione infusions for Parkinson's disease, but we don't have a good double-blind placebo-controlled trial, which is the rigorous trial to show if something really works, to say, yes, glutathione does something good for Parkinson's. So with a lot of those things that are out there, I would say take them with a grain of salt and be cautious and don't spend a lot of money unless you've got good evidence to say it works. Unless you're participating in a trial, but I wouldn't pay lots of money for stem cells until somebody can show me that it works.
About probiotics.
Nothing special about probiotics. May help with constipation. Yeah. Prune juice helps with constipation too.
What about exercise?
Yeah, so exercise is really important for Parkinson's disease. It's a little bit hard to show the exact effect of exercise and disease progression because people know if they're exercising, so it's hard to do a placebo. But there are definitely studies that have shown benefit for exercise. So we typically recommend doing a combination of things. So some cardio, some strengthening. Tai Chi is really good for balance, but basically keep moving is important. And we actually there's Rock Steady Boxing, if you guys have heard about that. So that's pretty new in our area. There's a group over in Largo that does it, and then also one here in Tampa. So it's boxing for Parkinson's patients, non-contact. You do heavy bags, speed bags, sparring, that kind of stuff. And our patients love it. Everyone who's done it comes back and they're like, no, I'm doing great. I don't need changes in my medications. So I think it's a mood booster too.
Can you tell me why that particular, because I've heard that too. I've heard dancing is really good, but I've heard a lot about boxing. What is it about?
I think it's just the hot new thing. I don't think it's necessarily something that's like, oh, that's way better than walking 3 miles every day. I don't think that that's necessarily the case, but I think it's nice to do it with other people. I think that's part of what people like about it, is like that camaraderie. It's also 90 minutes, I think, the classes, so that's pretty long to be exercising. And it's intense. It's intense exercise, so it's definitely more intense than going for a stroll. Yeah, so I think it just happens to be the hottest, newest thing. But I don't know that it's necessarily worlds better than doing something else.
Kelly.
Yeah.
They do pedaling with Parkinson's.
Yeah. The YMCA, right?
And the Bobsleigh or what?
Yeah, so that's another thing, is they have basically spin classes for Parkinson's patients,
Where?
pedaling for Parkinson's at the YMCA. So there's a
Is it
South,
YMCA?
yeah.
Like the Long Center in Clearwater?
I don't know about Clearwater. I know that there's 2 in Tampa.
There's South Tampa and there's Bobsleigh and Rondale. And I understand there's a Y in New Tampa I don't know if they've started it yet. I think they were next.
Yeah. And then we also we got a grant from the National Parkinson Foundation to do the Edmund J. Safra Parkinson's Wellness Initiative. So that includes exercise classes for Parkinson's patients and a support group for caregivers, and that's put on at the local GCC here in Tampa. And we do like new semesters every once in a while. I think we recently enrolled.
The first start date for those classes are November 1st. So we're doing Tai Chi, Nia, which is movement and music, and the third one is stretch and strengthen.
So that's another opportunity for exercise.
You can call me if
Boxing.
you're interested.
Pedaling for Parkinson's and the Wellness Initiative. But basically keep moving. Other questions?
He used to go to a Tai Chi class in Spring Hill
Uh-huh.
for years, and then they stopped it.
Yeah. So
Come to
I know
ours.
that.
It was
Come
too far,
on.
this was only a few
Oh,
blocks away.
Yeah.
And it was a full class, and then all of a sudden they said they had no more funds.
Yeah.
I thought that was pretty rotten of them to do that.
Well, I hear what you're saying, but so that was something that was supported by our clinic. That at the time when it was started, we did have funds. But when it comes to the point where we either have to fire someone or keep Tai Chi classes going, I think the priority comes first with inpatient, in-clinic care, and then if we can do those extra things, we try to. And so that's how we got this grant. That's another thing that we've gotten to help support it.
The one at the JCC though, and correct me if I'm wrong, because my brother-in-law went, the Tai Chi class is happening at the same time as the caregiver support group, and there's not a whole lot of, participation. When he was going, there was only 4 or 5 people. I don't know if people just don't know about it, but he loved it. And that's a good thing to tell people, because if they do get the participation, they can continue to go, as opposed to, like you said, losing it.
Yeah, yeah. And I mean, I think that there are other like Tai Chi places that do Tai Chi, but you may have to pay $10 a class or something like that.
Yeah,
We loved
but he did go to one, but it's too advanced.
Yeah,
This
it's
one
not
was
the
just
right
for
level.
Parkinson's people.
Yeah.
That's what this one is.
Yep.
Yeah.
All the classes that we have are adapted to Parkinson's disease patients. So.
Where is
He was doing
It's at the JCC in Tampa, downtown.
It's like over by Citrus Park. Citrus Park area, you know where that is?
Yeah,
Yeah.
oh, okay. Is that just JCC?
It's a Jewish Community Center.
Oh, well, hey.
Yeah. But you don't have to be Jewish, for everybody.
It's on Campus Community Drive. Campus Community Drive, off.
Yeah, I think it's $12,
Right close to
$60 for a
the,
semester.
veterans.
This session's classes are only $30. Tai Chi, I believe, is $35 because it's a shortened exercise session because of the holidays coming up. So it's just from November 1st to December 16th. That's 6 weeks of classes. So if you want to try
What,
it,
like
now
once a
would be a
week?
really good time
Once
to
a week,
do
yeah.
it because
Once a
it's cheaper.
The caregiver support group is free now.
The caregiver support group is free, and like she had said, it's at the same time as the Tai Chi class, so it's a really great opportunity for a caregiver and a patient to do something at the same time.
So I think if you guys are interested in that, what's the best number to call, Krista, for JCC?
If you want more information on exercise classes, you can call me at 813 396 0765. That's my direct number. So if you want more information, we have to do an intake form and a registration form. So it does take a little bit of time, but it's good questions. It's worth it.
And keep your eyes and ears open. We'll be doing the Moving Day, which is the Walk for Parkinson's Disease to raise money for Parkinson's with National Parkinson Foundation in April.
For years and years, we used to go to the fundraiser parties that Dr. Hauser did, and
Yeah.
then they stopped too.
Yep, so that was put on by the social worker, which we don't have the money to support a social worker right now, so we don't have a social worker. We have a freelance social worker that we refer to, but nobody that works for our office. So believe me, we are working hard. We are working hard. We have 2 clinical coordinators and me and Dr. Hauser and Dr. Burke to do something like 15 clinical trials. So we're very active, staying busy, we're doing what we can.
But the therapist that runs the support group,
Yeah.
our family has used her also for some family counseling. I can't say enough good things. She's fabulous.
Mindy.
Yeah.
Yeah,
Mindy,
Mindy.
Mindy, she's awesome.
Fabulous.
She's great.
I don't know what I would do without
Me either.
her. Other questions about Parkinson's or research? Who wants to go sign up for a trial? I only convinced one person. No, it's okay. But if you're interested in trials, you can call me. I'm Kelly, and thanks for coming. And I'm here if you have other questions.